Can your HIV drugs stop working? Well, that's what we're talking about today on Plus Talk, where we turn positive into a plus. Here to have this conversation is Dr. Charlene Flash. She's the president and CEO of Avenue 360 Health and Wellness in Houston, Texas, and our friend Paul Aguilar, who is a long-term HIV survivor. Good to see you both. Thanks for making the time.
Thank you.
Thank you.
So, Dr. Flash, in a nutshell, in the simplest terms, what is drug resistance?
Drug resistance, in terms of HIV, is when the virus gets smart and changes or mutates itself so that the treatment drugs you're trying to use against it no longer work well.
Okay, so are there signs? Like, how can you tell if your HIV meds are still working the way they're supposed to be?
The best way to tell is actually to be in partner with your clinician, and they should draw labs. And the first sign will be that your viral load, or the amount of virus that's circulating in each milliliter of your blood, starts to be at a detectable level. Don't freak out if it's just detectable, but if it goes up above 200, then you have to ask yourself the question, are my drugs still working?
Right. And Paul, as I mentioned at the top there, you're a long-term HIV survivor. How long have you been living with HIV? And you have experienced drug resistance. Can you tell me about how you learned the first time?
Well, let's see. I tested positive in 1988. I was 25. But we figure I actually acquired the virus much earlier than that because it was my very first test. And, the virus had been around a while. The drug resistance, well, one of the first ones I was on was one of the very first ones they had, which was very hard on your system. And so for a while, I was resistant to even start medications again. But I did finally in 1996 when those meds came out, the cocktail, as they call it. And I took that cocktail for a while. And then we came to find out after a switch in medical professionals that I had actually been on the wrong cocktail for like 5 years. And we kept wondering why my viral load wasn't becoming undetectable and why my CD4 count wasn't climbing. And they did some tests and went, oh, we've got you on the wrong meds.
What's that moment like for you?
It was frustrating. It was scary. I was angry. Back in those days, there weren't a lot of options. I mean, in the early days, my mindset and many of my peers and colleagues were to stay off the meds as long as possible because to stay drug naive because there weren't a lot of options of medications, before 1996 or even shortly after 1996, there was only a limited amount of these protease inhibitors. And so the theory was the longer you stayed off of them, then when you went on them, the longer you could be on them. Of course, we now know that's the opposite. But it was really frightening because I thought there's not a lot of other options of meds for me to go on after this cocktail was clearly the wrong one I was on.
Are there like 3 telltale signs that I will notice physically about myself or symptoms or something that might make me go, hang on a second, maybe the meds aren't working, I better get in touch with my healthcare professional? Or is there sort of no way of knowing?
HIV is so sneaky. And so it is difficult to say, these are the 3 things that'll happen. Maybe you'll start feeling more tired than usual. Maybe you'll get a low-grade fever. Maybe you'll notice some swollen glands as your lymph nodes swell up. Maybe you'll get a rash, or maybe nothing at all, right? Because it really depends on where your immune system is. And so if you have a really robust immune system, the medication could stop working and your immune system's still doing its thing and you don't notice anything for months and months and months and months. It's only when your immune system starts to weaken that unusual things will happen. You say, okay, well, I'm not supposed to have thrush. What's going on? Right?
Yeah.
And so the best recommendation I would have is you got to get that lab work. You want that early warning sign. You don't want to wait until you're feeling something.
Yeah, that's true. It's taking responsibility for your health and making sure that you are checking in with your healthcare provider to get those labs. Paul, I think we should also say it's important not to panic, right? You know, in this day and age, I think, you know, Paul, you talked about, you know, the first time this happened a long time ago, but I think more recently, you know, within the last, and correct me if I'm wrong, it's come up again in your life. What sort of steps beyond not panicking did you and your healthcare team take to get you back on track and get you back to undetectable?
Well, when it was just within the last year and a half when my viral load went to over 1 million logs, we were a little concerned. So we did some phenotyping and genotyping, which is a type of test that the doctors can do to determine what medications, if you're on a combination of medications, which ones aren't working. And then after that was determined, then nowadays we had many options of combinations to take. And so I talked with my care provider about, you know, what the side effects were, what the options were, what the ramifications of, you know, each and various sundry medication was. And then we came to the determination of what is now the regimen I'm on.
And how long roughly did it take you to get back to undetectable and, you know, we're back on track?
On my new regimen, in a month.
That's incredible. Like that's the good news in all of this, right, Dr. Flash? That, you know, as Paul said, we now have so many options. How common is it, Dr. Flash, for, you know, treatment to become resistant?
So if planned out properly, and if someone actually is choosing a regimen that either is very difficult for a drug to become, for the virus to become resistant to, or selecting a regimen and really thoughtfully looking at not just your genotype today, but all of the archived resistance you have over time. So doing the legwork of pulling all your old lab tests and comparing them all and doing the Sherlock Holmes to see so that you can determine what's the best regimen, it's really pretty rare. Now, the times when I've seen patients run into trouble are when they're taking another medication and they're having a drug interaction. Sometimes it's a vitamin or an antacid or something that's actually making their medication not work well for them. And so they're doing what they're supposed to do and they're taking their medication, but their body's not seeing the full dose. And so then the virus can outsmart it. Or, you know, life happens and sometimes patients miss doses. And so one missed dose is not going to, you know, don't sell the farm. But if people are constantly tickling the virus with medication and just, you know, every week they're missing a couple doses and just constantly missing, then those are the times when you'll have drug failure.
Yeah, and you know, it's funny. I have acid reflux. I know that there are certain brands of antacid medicine I just can't take, and that again comes from conversations with my healthcare provider. Dr. Flash, is this something that long-term survivors, people like Paul, should be checking more frequently for because people like Paul have been taking meds for so long in so many different capacities?
So I think that if someone has a partner, a clinical partner, and you're getting your routine evaluation every 4 to 6 months or so and getting you that lab work to verify, then you should be fine. Now, we engage, and I think we talked about this the last time we talked, about this concept of shared decision making. Now, if you know that life has gotten complicated and you have not been taking your medication the way that you would want to, don't wait 6 months, right? Come in and say, hey, doc, I was in Bolivia and I didn't have my meds and I know I wasn't doing what I was supposed to be doing. Can we just get some labs because I want to understand what's happening? I know the labs are going to look ugly, so don't freak out when you see them, doc. And then let me come back in a couple of weeks and make sure it's going down appropriately.
Yeah. Paul, for you, what was it like being able to have those kind of conversations? I don't think you were in Bolivia, by the way, but what was it like? I know who your personal care provider is, and she is an amazing, amazing woman. What was it like to be able to have those kind of conversations like Dr. Flash is advising you do to help put your mind at ease and go, now, come on, we're going to get this back on track. Do not panic.
It was comforting. It was empowering because it was taking, responsibility solely for my own health care and knowing that there was action that I could take. There were options, and that having this conversation, because I'll be honest with you, mine was because of noncompliance. After so many years, I have several colleagues and peers who are also running into this. There's just this resistance after 35 years of taking meds to taking them. It's this weird phenomenon.
Pill fatigue.
To have the conversation with my medical care professional without having the judgment, because there was no judgment. They're like, yeah, I've been seeing that in my patients. Oh, in some of her patients. So it made having that conversation that much easier. It's like, okay, so I'm not like this, it's not like being punished in school. Oh, I didn't do it. It happens. And to have those alternatives in those discussions, it made it that much easier to just go, okay, well, that happened. Now we do this.
Really, really interesting conversation. Thank you so much, Dr. Flash. And Paul, great to see you. Thank you so much for joining us too.
Thank you so much. Thank you so much. Take care.
Absolutely, anytime.
That is going to do it for this episode of Plus Talk. If you want more information, check out our website, pluslifemedia.com. And remember, you can like, follow, and share on social. We are at Plus Life Media. Until next time, we always say, be nice to one another. We'll see you soon. Bye-bye.